Mr. Anurag is a 27-year-old man who is an engineer by profession. He has a happy job, a happy life and a happy wife. But one fine day while he's working, he notices that he's got severe abdominal pain. And for that abdominal pain, he's rushed to a hospital where Dr. Mankar is treating him. Dr. Mankar notices that Anurag's eyes have gone completely yellow, indicating that jaundice is present, and jaundice is a sign of liver disease. After doing proper investigations and ultrasonographic imaging of the liver, Dr. Mankar tells Anurag something which would completely change his entire life. Anurag is a sober person who has never touched a single drink, never touched a single cigarette, never done any addictions. But Dr. Mankar tells him that his liver is about to fail. And if they are not able to stop this liver from failing, Anurag might have to go for an urgent liver transplant to save his life. So what went wrong in an apparently healthy 27-year-old man who was working, who was an engineer, who was happy, did not have any stress and absolutely no addictions? Well, that's what we're going to be discussing today in Case Files episode 5. Hello everyone, I'm Dr. Anuj Pachhel, an MBBS intern working at GMC Nagpur, and I bring to you Case Files, a series where I discuss amazing and intriguing medical cases that have happened all throughout medical history, and showing you how wonderful, how fantastic the human body actually is, and showing you the cases which you might not know even existed. Please subscribe to never miss a single Case Files episode. Let us start from the start. Mr. Anurag belonged from a middle class family in Nagpur. His parents both belonged to the banking sector. He had an elder brother who actually passed away because of some sort of liver disease when Anurag was still a child. Anurag from then was very serious about his health and never took anything for granted. He always went to a medical specialist whenever he had any sort of problem and always got it checked out because he was always afraid that he would suffer the same fate as his brother. So he was a very regular member of the gym, always took care of his health and never ever dabbled into any sort of social addictions such as alcohol or cigarette smoking or drugs. He was also a very sharp-minded student, which allowed him to pursue a good engineering degree from a great college and landed a high-paying job. Everything was going fine, but 2 years ago, Anurag noticed that his hands were having some sort of mild tremor. जिसमें हाथ shake करने लग जाते हैं. And being medically cautious, he went to a doctor to check it out. The doctor told him he had some thyroid issue, and for which the doctor gave some medications. The tremors were slowly improving. The thyroid medications were going on, and Anurag had absolutely no problems doing his day-to-day work. 8 months before the incident of today, Anurag actually had a similar episode of nausea and vomiting plus abdominal pain, for which he was taken to a local hospital where the doctor, after doing several tests including a liver function test, told him that Anurag, you got some sort of hepatitis. Hepatitis B and C viruses have come out negative in your test. So we are suspecting it to be hepatitis A or E, which is very commonly found in the area which you are coming from. After the treatment, Anurag went back home with absolutely no complications and was perfectly fine. Until 7 days ago, when he started to develop very mild yellowish discoloration of the eyes. First, he did not even notice that it is happening. Only when it was increased by quite a lot did his wife actually take notice of the discoloration and told him. He was planning to go to the doctor after 2 days because he had some sort of project coming up. But within these 2 days, his entire health deteriorated by quite a lot. He started having severe bouts of nausea and vomiting, and he vomited around 6 to 7 times. Plus, his abdomen started to ache. The ache was so severe that an ambulance had to be called and he had to be rushed to our casualty. Case file: Mr. Anurag, 27-year-old engineer, middle class. Presented to our casualty with the chief complaints of yellowish discoloration of the eyes for the past 7 days, vomiting since the past 1 day, and severe abdominal pain since 3 hours. The patient was apparently asymptomatic 7 days ago when he started noticing a yellowish discoloration covering over the eyes, which was insidious in onset and gradually progressive. The yellowish discoloration deepened over the course of the 7 days and involved the entirety of the eye. The discoloration did not spread to other parts of the body, including the palms and the soles. There were no aggravating and relieving factors for the same. Yesterday, the patient also started having bouts of vomiting 6 to 7 times, which contained undigested food and acid. They were not having any sort of blood, and there were no aggravating or relieving factors for the same. 3 hours ago, the patient also developed severe abdominal pain, more towards the upper right side of the abdomen where the liver is supposed to be. There was no radiation and it was dull in nature. There was no positional variation for the pain as well. There is no history of clay-colored stool, bleeding tendencies, rashes, fever, breathing difficulty or difficulty in urination. There is no history of consumption of any sort of poison. Significant past history is that 8 months ago the patient had an episode of hepatitis which was treated in a local hospital. The hepatitis B and C markers at the same time were negative, and bilirubin was never above 5, and the patient made an uneventful recovery ever since. The antithyroid medication was started because he noticed a tremor in his hand around 2 years ago. Anurag's family history suggests that his sibling has died of some sort of liver disease when he was just a child. The patient is a non-alcoholic, non-smoker without any addictions. On examination of the patient is lying on bed comforting the abdomen. Temperature is 97.6 degrees Fahrenheit. Pulse rate is 118 beats per minute and BP is 110/74 millimeters of mercury. Pallor is present, icterus is present and no cyanosis clubbing or lymphadenopathy. On checking the abdomen of the patient, the abdomen is tender and guarding is present. However, no rigidity is found. There are no obvious signs of portal hypertension such as caput medusae or distension of the abdomen or any organ growing up. On palpation, the liver is enlarged, the border is irregular and the surface is smooth. The gallbladder is not palpable, the kidneys are not palpable and the spleen is not palpable. Auscultation, bowel sounds are heard and the patient is sent for ultrasonographic evaluation. The USG report confirms the liver to be enlarged and shows hypoechoic areas and excluded the possibility of vascular compromise. The hepatic artery, portal vein and the hepatic veins have good flow in them, so there is no vascular anomaly which is present in the liver. The patient is on anti-hepatic drugs, anti-pain medication and on IV fluids because of the dehydration. He is admitted in the ward for further evaluation. The samples are taken and sent for investigation. As Anurag is present in the ward and the condition is stabilizing, let me tell you what exactly is going wrong with his body. The liver is a very big organ responsible for so many different things in your body. Whenever there is a problem with the liver, one of the common symptoms that we get is nausea and vomiting. That is what we are seeing with Anurag as well. The liver is enlarged on ultrasonography, which kind of explains the abdominal pain. However, it could also be due to the vomiting. Since the past history of hepatitis is present, we are strongly suspecting a viral origin because viruses can attack the body repeatedly and cause repeated attacks of hepatitis along the way. For example, hepatitis B virus, if it enters your body, there is no way for that virus to leave your body. It will always stay dormant in your liver and it will cause repeated attack of acute hepatitis superimposed over a chronic hepatitis state. The blood flow to the liver is maintained, which excludes the possibility of veno-occlusive diseases like splenic vein thrombosis, portal venous thrombosis or Budd-Chiari syndrome. Till now, we are only looking at the case by the lenses of the liver. We are only looking at the case like it's a GIT case. That's why it's actually taking time to exactly pinpoint where the disease is lying. Well, the next day when Anurag was stabilized a bit, a proper examination of all the systems of the body was conducted. This is something which is very crucial and should be done for every clinical case. Not just the system which is presenting you, in this case the abdomen, but also the respiratory system, the cardiovascular, CNS, the blood and so many different systems along with it. And this is the turning point of the story. The patient had very subtle speech difficulty. The patient was not able to articulate the words properly. He was fluent, but the words had so much gap in between them. A condition that we actually call as dysarthria, indicating that the parts controlling the speech in the brain had somehow been damaged. How did a liver disease so quickly damage the brain in such a way that his speech was impaired? Other higher mental functions like cognition, memory and intelligence were intact. On examining the cranial nerves, they were intact too, but on examining the motor system of the body, we found out something more. The tremors which the patient had were of low frequency, high amplitude type and were coarse in nature. They were also present during rest. And on carefully examining the gait of the patient, we found out there are subtle incongruencies in the walking style. The coordination between the walking is not that well. The gait is slightly unbalanced. Checking the muscle tone, the tone is slightly increased. All other systems were apparently normal. So how could a liver disease affect your central nervous system so much as to cause speech disturbance, as to cause tremors, as to cause gait disturbances, balance disturbances, increased tone? Were there two different diseases affecting the same person at the same time, or was it just one single disease affecting many systems at once? While we are thinking about that, the test results actually came back. Let's look at the reports to find out what is going wrong. Let's first look at the blood report. The CBC showed that the person had anemia, a hemoglobin of 9 grams per deciliter. The WBC count was slightly increased and the platelets were normal, excluding dengue to be a cause of hepatitis. On the peripheral smear, the blood showed that there were RBCs which were destroyed partially. So this disease, whichever it was also affecting the blood, which also sort of explains the increase in bilirubin, because RBC breakdown releases hemoglobin in the blood, which is then metabolized into bilirubin, which rises and explains the yellowish discoloration. Talking about the liver reports in specific, the liver enzymes were slightly elevated. The liver cells contain a lot of enzymes, and when they burst out open, they release these enzymes into the blood, and where we can detect them. The bilirubin was high, it was 6 milligrams per deciliter. The indirect fraction was more, suggesting it was more of a hemolysis than a proper post-hepatic cause. But now comes the most important investigation that we ordered, which would point directly towards the diagnosis of this disease. We ordered the levels of ceruloplasmin in blood. Ceruloplasmin is a molecule which binds to divalent metal ions, for example copper in the blood, and the ceruloplasmin levels in this person were extremely low. They were almost 10 times less than expected. And this pointed towards a diagnosis of a disease which would affect the CNS, the liver as well as the blood. But before I tell you the name of the disease, an ophthalmic examination was also conducted to see what going in the right direction. And the ophthalmologist actually did tell us that the person's eyes after doing a slit lamp examination showed KF rings, Kayser-Fisher rings in the eyes. And with all of this knowledge, we came to a conclusion that this is a case of Wilson's disease. What is Wilson's disease? Let's find out more. When you eat anything, it has to be assimilated through the intestines, and so are metal ions. In your food that you make, you have so many metal ions which are present, from iron to calcium to zinc to magnesium to aluminium and to copper. All of these metal ions are required by our body, so your body starts to absorb them through your intestine. As soon as they are absorbed through the intestine, they go to the liver, where a lot of these metal ions are stored in the liver cells as well as released into the blood to go into various different organs. And whenever there is an excess of metal ions, let's say due to increased intake, your liver actually secretes this metal ions into the bile, and then the bile excretes it out through the GIT. So your liver is a key component which regulates how much metal ion is going into the body and how much is going out. The most important step over here is how much the liver can throw out, because if an excess is happening, the liver will be the organ most of the ions and throw them out. In Wilson's disease, what happens is that this secretion system is very defective. The liver specifically cannot throw out the copper ions which are present in blood. Copper in the blood actually keeps on going higher and higher and higher. So what does the body do? The body does what it always does. It compensates. It secretes a protein called as ceruloplasmin in the blood, which binds to these copper ions and then is excreted by the urine. So the blood copper levels are kept in check. But at the same time, this protein ceruloplasmin is being used up, so its level falls down quite a lot. Let me just summarize what is happening. You are eating copper ions on a daily basis. They are being absorbed by your intestine. They are going to the liver. The liver is directing them to various tissues which utilize that. The liver is also storing some copper ions within itself. But the liver is not able to throw out these copper ions into the bile because the secretion system is absent. And for that exact same reason, the copper levels in the blood is rising. So the liver releases ceruloplasmin which will bind the copper ions and decrease the level of copper in the blood. But at the same time, the ceruloplasmin will get used. And since it is getting used, the levels of ceruloplasmin will go down. But the copper will still continue to accumulate. This accumulation of copper will actually injure the hepatocytes which are present, the liver cells which are present, and cause them to die slowly and slowly and slowly. And these hepatocytes, when these liver cells actually rupture, they release the hepatic enzymes like SGOT and SGPT, as well as the copper which was stored in them. This copper goes to the blood and destroys the RBCs which are present. And so we get the picture of destroyed RBC or schistocytes present in the blood due to this excess copper released by the death of the hepatocytes. Now this copper starts going into other places. It goes to your brain. It crosses the blood-brain barrier. It first enters the astrocytes, the oligodendrocytes, and causes death in them. It causes decrease of myelin sheath, and it goes to its favorite place, the basal ganglia. And it stays and affects the basal ganglia, which explains the symptom of dysarthria as well as rigidity and incoordination of movement. And we see a picture of a CNS disease. Not just that, the copper goes to your eyes, specifically your cornea, and attaches to the descent membrane. Causes a ring of copper beautifully seen in the eyes by the ophthalmologist called as the KF ring. All of these changes in the body are happening so slowly over the course of many years that you might not even notice that it is happening. Your body is so good at compensating chronic diseases that until and unless it's in the very late stage, you won't even know that you have a disease. And that is exactly the case which happened with Mr. Anurag. He had this disease since he was a child. His brother actually died of the same disease but was not evaluated further. But we caught it in Anurag, and we started the treatment to reduce the copper levels in the blood, because everything that is happening wrong with the body is being done by copper. So we have to reduce the copper levels, and we're going to be giving him a diet which is free of copper. Secondly, we're going to be giving him drugs which inhibit the absorption of copper, that is zinc. And lastly, we're going to be giving him some drugs which chelate, which bind the copper in his blood and excrete the copper out. So that is the exact therapy which he was started on, and very thankfully the liver has a tremendous capacity to regenerate it, and that's what happened. His liver enzymes normalized, the liver was able to compensate, and at the same time his CNS symptoms improved. Mr. Anurag was very lucky to have been diagnosed of Wilson's disease in the first place, because ceruloplasmin is not a very common investigation which is done. And this really highlights the importance of two things. First of all, looking at all the other systems when a patient comes to you, so that you are not missing out on a certain key finding which may be present. And secondly, investigations that are to be done have to be read so carefully so as to come to the diagnosis very promptly, because medicine is the only subject where human lives are at stake. If you do a mistake, it will cost a life. And that's why I have huge respect for all the doctors that I work with, because they are literally heroes which save life every day. And that was the story of Mr. Anurag. If you did enjoy this episode, you have to absolutely write down in the comments, I loved Case Files episode 5, waiting for new ones. And I'll keep them coming. Please make sure to also hit the subscribe button. It really helps out quite a lot. And I'll see you in the next one. Bye.